In this video, we present the top 14 best counseling case management software platforms. But first, here's the reality. About 62% of counseling and behavioral health practitioners are still relying on disconnected systems, including using spreadsheets or outdated databases or multiple applications that don't communicate with each other. This often leads to inefficient workflows, delays in client coordination and care, and also increasing compliance challenges. Which is why in this video, we are presenting you with the top 14 best counseling case management software systems so that you will know exactly which software fits your organizational size, budget, and caseload. And stay until the end because we will also show you how to start a free trial today of one of these top counseling management software systems. Let's jump right into it. Here is how we ranked these software platforms to help you manage your counseling practice. We looked at areas that matters the most for most counselors. That includes ease of use, HIPAA compliance and security, reporting capabilities, workflow efficiency, mobile access to mobile features, integrations, scalability, and overall, how affordable are each of these platforms for you. Now, some of these counseling practice management platforms are clearly built for individual solo therapists and counselors and smaller private practices. Others are designed for larger behavioral health organizations, nonprofits, and multi-site counseling programs. So, as we go through this list, don't focus only on rankings. Focus on which platform actually fits your organization, your team size, your documentation requirements, and the way you and your organization delivers care to clients. Now, before we continue, one thing to note is we will provide an overview of each one of these platforms, and then we will provide a summary and a recommendation as to which one you can sign up for. So the first on our list is Case Management Hub. Case Management Hub is built for counseling organizations, behavioral health teams, social workers, and nonprofits that need a flexible but affordable platform that they can use end to end for their entire practice, including managing clients, managing intake, and coordination with clients and any other incoming or outgoing referral partners, documentation, reporting, and many more. What immediately stands out about Case Management Hub is how well it balances simplicity with functionality. What do I mean by that? So, for example, it gives you one centralized place to manage client records, notes, including subnotes and any kind of notes, referrals, intake and assessments, client goals, follow-ups, messaging, and forms. So instead of relying on siloed spreadsheets or disconnected systems, you can use Case Management Hub for your one all-in-one platform. Another major advantage is the reporting functionality. Supervisors and leadership often track caseloads, outcomes, staff activity, and program performance much more effectively using Case Management Hub. And because it is cloud-based and HIPAA compliant, staff can securely access the system from the cloud from any location, which is effective for hybrid and mobile professionals. Now, the catch is this. If you are a solo provider with one or two or just a few clients, then the platform might feel more structured and with more features that you might currently need. But for growing organizations, including individuals and teams that are managing multiple clients, then Case Management Hub can provide you with that platform that you need. Pricing includes a free trial with no credit card required and starter plans at $30 per month. And also, you will also be provided with nonprofit discounts. So make sure you ask for that when you reach out to Case Management Hub. The next platform on our list is Care Logic. They are built for larger behavioral health organizations that need enterprise level operational management and compliance support. One thing that stands out about Care Logic is that it combines documentation, billing, scheduling, compliance, and reporting all inside one system. It also provides strong compliance support, which can help organizations manage payer requirements and regulatory standards much more efficiently. The catch is this, though, in regards to Care Logic, and that is implementation can take time. And there is definitely a learning curve, especially for organizations that don't have a dedicated technical support. Pricing is custom, so you will need to reach out to them for a quote. The next on our list is Console. Now, for this particular platform, they are designed primarily for solo therapists and smaller counseling practices that want something very lightweight, something easy to use. One thing users tend to like about them is the platform combines scheduling, telehealth, billing, and client communication tools into one system. Another benefit is that the billing tools help simplify payment collection and reduce administrative activities for individual counselors. But the catch is this: organizations needing advanced reporting or more complex workflows for client management may eventually outgrow the platform. Pricing is subscription based. The next platform on this list is ICANN Notes. ICANN Notes is built for psychiatrists and behavioral health providers who want to complete documentation faster and more efficiently. One thing that really stands out is the structured clinical note system, which is specifically designed around behavioral health and psychiatry workflows. Another advantage is that the structured templates that they provide, they help improve consistency and support compliance requirements. Here's the drawback. The catch is that some users feel the interface looks a little bit dated compared to newer platforms that you can find on this list. Pricing is subscription based. The next on this list is Jane App. Jane App is ideal for wellness clinics, therapy practices, and multidisciplinary providers that want a very user friendly experience. One thing users consistently mention is how easy the platform is to learn and implement. Jane App also combines the ability to chart or do charting, telehealth, and payment processing into one platform, which helps reduce the need for multiple systems. But here is the catch. Mid to larger size organizations may eventually need more customization as well as enterprise level workflow capabilities. Pricing starts at around $54 a month. The next organization, a platform on our list is HIPAA Health. HIPAA Health is specifically designed for addiction treatment centers and substance use recovery organizations. One thing that makes them stand out is that their workflows are built specifically around addiction treatment programs rather than general therapy practices. It also includes patient engagement tools that help improve communication and coordination throughout the recovery process. But here's the catch. There are a lot of organizations that, uh, for organizations outside addiction treatment, they might feel this platform is too specialized for their needs, in which case you want to consider other platforms on this list. Their pricing is custom, so you will need to reach out to them for pricing. The next organization on our list is Our Practice. Our Practice is built for private counseling and psychology practices that want secure and straightforward practice management tools. One thing that users like about them is the platform combines scheduling, billing, documentation, and secure messaging into one system. But here is the catch. Scalability can become limited as your organization grows. Pricing is subscription based. The next platform on our list is Penelope. Penelope is designed for nonprofits, social service agencies, and human services organizations that need flexible case management and outcome tracking. One thing that stands out is their reporting and outcome tracking functionality, which helps organizations measure program performance and also client progress. But here is the catch. Implementation may require additional onboarding and setup time compared to other platforms on this list. The next platform on our list is Salesforce Nonprofit Cloud, which is best for organizations that need advanced customization, analytics, and integration. One thing that makes Salesforce stand out is how customizable the processes are for organizations. Organizations can build systems that match very specific operational needs. But here is the catch. Setup and ongoing administration often require technical expertise or outside consultants. Pricing is enterprise level and customized based on your organization and need. The next platform is Simple Practice. Simple Practice is built for independent therapists and growing private practices that want an easy all in one platform. Another advantage is the clean and intuitive interface, which makes onboarding easier for smaller teams. It also includes built in insurance claim management tools, which can help reduce administrative work for providers handling billing themselves. Here's the catch. Larger organizations with more advanced requirements may eventually need something more robust. Pricing starts at around $29 a month. The next platform on this list is Theranest. Theranest is designed for counseling groups or mid-sized behavioral health practices that need a balanced mix of features and affordability. One thing users like is that it helps multiple clinicians coordinate scheduling, documentation, and client management more effectively. It also combines telehealth, billing, and notes into one centralized system. Here's the catch. Some reporting capabilities depend on you having to pay higher, upgrade to higher tier plans. Pricing starts at around $39 per month. The next platform on this list is Therapy Notes. Therapy Notes is built for therapy practices and mental health clinics that prioritize reliable clinical workflows and documentation. One thing that stands out is the structured documentation system that they have, which helps providers maintain organized and consistent clinical records. Here is the catch. Workflow automation features are more limited compared to other competitors on this list. The next platform is Therapy Zen. They are designed for mostly therapy startups and solo providers that want a streamlined platform. One thing users appreciate is the automated intake workflow functionality, which helps reduce repetitive administrative tasks. Another benefit is the built-in communication tools that help improve client engagement and follow-up communication. The finer platform on this list is Valant. After we go over this platform, we will now provide a recommendation on which one of these platforms that we just reviewed is best for you and your organization. Valant is built for behavioral health clinics and psychiatry organizations that need deeper operational oversight and behavioral health specific workflows. One thing that stands out with them is the behavioral health EHRO functionality, which supports both clinical operations and administrative management. Another major advantage is the outcomes tracking and analytics functionality, which gives leadership better insight into organizational performance. But here's the catch: onboarding can feel more enterprise focused for smaller organizations. So now that we have reviewed all 14 top counseling platforms, the big question becomes which of these best counseling practice management software is actually the right fit for your organization? And honestly, the answer depends less on which platform is the overall best and more on which one aligns with you and your organization, which one aligns with your team size, your the complexity of your workflow and processes, which one aligns with your reporting needs, your budget, and your long-term growth plans. As I mentioned earlier at the beginning of this video, some of these are designed for solo therapists and counselors. Others are designed for much larger ones. So if all you want is an all-in-one HIPAA compliant software for managing clients and programs, for reporting, for direct messaging and secure messaging with your clients and other incoming and outgoing referrer partners. If you need something for notes and other features and tools to manage your practice, then Case Management Hub is one of the best counseling practice management platform for small, mid-sized, and growing counseling and mental health, behavioral health teams. Now, if you are a solo therapist or small private practice that is focused on affordability, then platforms like Simple Practice, Therapy Zen, console.com, or Our Practice may be a great fit. And if you need a stronger behavioral health documentation and psychiatry workflows, then ICANN and Valant, they stand out. Now, if you have a much bigger counseling organization or a bigger nonprofit organization and you are managing very complex programs, then Penelope, CareLogic, and Salesforce Nonprofit Cloud provide more enterprise level scalability and a customization. And if your organization focuses specifically on addiction treatment, then Kipu Health is one of the more specialized platform on this list for you to consider. Ultimately, the best counseling management software is the one that helps your team and helps you save time, stay organized, improve collaboration, simplify documentation, and deliver better client care outcomes. At the beginning of this video, I mentioned I will show you how to start a free trial of one of the top counseling management software platforms on this list, and here it is. Case Management Hub offers a free trial with no credit card required. For mental health professionals, behavioral health teams, counselors, therapists, social workers, and nonprofit organizations that are ready to move forward and try out an all-in-one, then getting started is very, very simple. Just click on the link you see under this video in the video description to sign up for the free trial. When you click on that link, it will bring you to this page that we are looking at here on my screen. Just enter your first name and last name, enter your email address, and also we recommend you enter a phone number for two-way authentication. Also enter your organization name because the account will be created immediately under your organization name. We also recommend that you select your practice area. So for example, if your practice area is counseling, then you just select that. If it's counseling and mental health, you can select that. If it's also nonprofit, so you can select the ones that are relevant to your organization. And then click on I am not a robot, and then click on start my free trial. And within a few seconds, the system will create your account and take you to this page here. You can see immediately that you are provided on your main dashboard with quick actions. So you can add a new client, you can add multiple new clients, you can view standardized forms that you and your team can use, you can add a note to a client record, you can add tasks for things that you want to do to make sure they get completed. You can add staff member if you have more than one person in your organization. You can also create a program. You can upload files. You can create a group versus just creating one client. So you can create clients that are grouped together. You can also send out intake forms for clients to fill out. And when clients submit these forms, you get notified that these forms are completed. You can view clients, you can add appointments, you can also add locations. On the left here, sidebar, you can see the option to view clients, the option to add tasks, notes, letters, files, send intake forms. You can also see calendar for scheduling. You can also see reports and also analytics for your organization. And in regards to clients, you will see what we are looking at here is a sample a list of clients that we entered into the platform for today's demo to show you how easy it is for you to view your clients. You can filter for clients, you can search for clients, you can view active versus discharged clients. So this platform really is an all-in-one which you can start using today. So don't hesitate, click on that link under this video, sign up for this. And if you have others within your organization, we recommend you also add them by, you click on add new staff, you add their first name and their last name, you add their email, and you add their role. We recommend employee role, but if you want to give them higher access, you can give them admin access or account owner. Account owner has full access to the entire platform. And when you click on save, they will be notified to log into the system. But we also recommend that you send them an email or a text message that you've added them to the case management hub for you and other members of your team to test out. If it's just you as a solo provider, then you don't need to add staff, but just go ahead and add your programs and also add clients under your specific programs. And don't forget to like this video, as that lets me know that you have received value from it. You can also subscribe to the channel so you don't miss great content like this one.